Let's get started. First of all, I want to introduce you to some of our program directors that's joining us tonight. So we have Dr. Denny Faye Agana. She's the program manager for the Masters of Public Health programs. Then we have Dr. Jacob Moses. He is the program director for the Bioethics and Health Humanities Master of Arts and PhD program. Then we have Dr. Heidi Spratt. She is the program director for our Master of Science in Biostatistics and Data Science. So we are an accredited school. We became accredited, I believe, 2 years ago, our school, but we have been, our MPH program has been accredited since 2002 by the National Public Health Accrediting Body, the Council for Education on Public Health, and for short, we call it CEEF. Currently, we have about 140 students across 5 graduate training programs. And you will have an opportunity to learn from and work with national and international experts on public and population health here at SPPH. So here are a list of our master's programs. We again have the Master of Arts in Bioethics and Health Humanities. Our Master of Public Health, we currently have 5 concentrations. We have concentration in bioethics, biostatistics, and the biostatistics concentration you can complete it in person or fully online, and we'll talk more about that. We have epidemiology. We also have a public health leadership concentration, which is exclusive to those that are admitted to the John Seeley School of Medicine. So they have an opportunity to complete that concentration within the same 4 years of medical school. So it's an exclusive program only to those that were offered admission to our School of Medicine here at UTMB. And then we have the public health practice concentration. And finally, we have our Master of Science in Biostatistics and Data Science. So first up, we're going to have Dr. Moses to speak more about the Master of Arts in Bioethics and Health Humanities. And you're welcome to take it away when you're ready, Dr. Moses.
Great. Thanks so much, Christine, and thank you, everyone, for joining. So I'll talk a little bit about the offerings in bioethics and health humanities. Next slide, please. The Department of Bioethics and Health Humanities at UTMB is an interdisciplinary research and teaching program that's rooted in philosophy, literature, religion, history, bioethics, law, and the social sciences. We seek to illuminate values questions in healthcare settings, elicit meanings from illness, and cultivate critical intelligence that probe the making, meaning, and authority of diverse knowledges. So we are a department in the School of Public and Population Health, and we're also an institute. And the institute has been around for more than 50 years and recognized as a cornerstone institution in the field of bioethics, and we're really a founding institution in the health humanities as well. And so we're so happy to be part of the school and to have this important role in the fields of bioethics and health humanities. Our graduate students across all of our programs are full members of our department, which is comprised of faculty, postdoctoral fellows, of course, graduate students and staff. Next slide. BHH at UTMB has some core research areas. This isn't an exhaustive list, but does give you a sense of some of the strengths of the department and our graduate programs. We have interest in applied ethics, translational humanities, so bringing the tools of humanistic inquiry and research to bear on health policy and practice, and health justice is a major focus of many of our faculty's research projects. Next slide. We have multiple offerings at the graduate level, including the Master's in Public Health with Bioethics concentration, which is really a hybrid. You get a full MPH, but are able to focus some of your coursework and and project work in the field of bioethics. We offer a master's degree, which is comprised of 10 courses, and a certificate, which involves taking usually 4 courses in the department. These classes that yeah, next slide, please. It's perfect. The classes that we offer really cover a full spectrum of the fields of bioethics and health humanities. On a regular basis, we offer courses on Intro to Health Humanities, Foundation in Bioethics, Interdisciplinary Methods, which is really grounded in humanistic and qualitative social science methods, histories of health and bioethics, and public health ethics, which is a core course of the MPH with bioethics concentration. Across these courses, we seek really to expose our graduate students to multidisciplinary collaboration, as well as a grounding in the foundational work and methods of these fields. The courses are really small, and that allows for lots of participation from our graduate students, interaction with each other and with our faculty, and so these are really almost lab spaces for collaboration and learning. Our courses in bioethics and health humanities are offered in person only, and again are really these very interactive seminar format. Next slide. And that's what our students and graduates really tell us, is that they really value opportunities to engage faculty in mentorship opportunities, and the community of BHH that allows students to work with faculty from different disciplines, including philosophy, literature, history, and other bioethics fields. So our students really get exposure to multiple points of view that they can apply to their research and career goals. And so with that, I'll leave it there.
Thank you, Dr. Moses. Next up, we have Dr. Denife Agana. She's going to speak more about our Master of Public Health.
Thank you, Ms. Christina. So let's go ahead and get started and talk about the MPH. So our program prepares students to protect and improve health at the population level through applied training in public health practice, data-informed decision-making, and community partnership. And as Ms. Christina mentioned earlier, we have 5 concentrations. In particular, though, the 4 top ones, bioethics, biostatistics, epidemiology, and public health practice, are what are offered for our traditional MPH program. And the other one that she mentioned, the public health leadership, is solely for the MD MPH program. So you'll see there that there's these little asterisks describing both the PhD MPH program and the MD MPH program. And for those 2, you have to be admitted into their respective programs within UTMB first before considered into the dual program with the MPH. Typically for the PhD MPH, typically students go the epidemiology concentration, or we've had one that did biostatistics, but traditionally the PhD MPH end up doing the epi concentration. For the MD MPH, it is the public health leadership concentration, and there isn't an option to choose for that one. Every MPH has similar requirements, and that includes 42 credit hours of work, which is approximately 4 to 5 semesters. Your coursework include both core and track-specific courses. Next are 2 experiences that are not your traditional class format. So the applied public health practice experience, or you can think of that as a capstone. And this is where you kind of act like, I like to say to students, you are a consultant for an external agency, whether that be a governmental agency, it could be a non-for-profit agency, but just think of yourself as someone who is working for them and helping come up with public health deliverables that agency needs. On the flip side, the integrative learning experience is internal to UTMB and you work hand in hand with a faculty mentor. So if you think of a scholarly paper, somewhat like a thesis, that would be what the integrative learning experience is like. And then last, in order to graduate, you will need to have one presentation. You could do that at a national conference or a state or local conference. And typically they are on either the APE or the ILE that you did. APE meaning Applied Public Health Practice Experience, or ILE, the Integrative Learning Experience. And if you don't end up doing one of those presentations elsewhere, we give you the opportunity during our National Public Health Week to present at our Public Health Day. Next slide, please. So why the Master of Public Health? As mentioned earlier, we are CEF accredited, and also mentioned earlier, we have very small class sizes. So there's close attention to our students, and our ratio is actually 1 to 4. So you will get to know your professors very well, and they'll get to know you very well. There's also hands-on practice. So there's a lot of opportunity to work with community partners, with academic partners, and you will get that hands-on experience by a number of opportunities that are available to you, but also because of how the MPH is set up, where those experiential learning experiences are required for graduation. We also have a very supportive culture. So if you become an MPH student, you will have a semesterly advising session. I particularly mentor the MPH and epidemiology students, and then Dr. Moses, he mentors the MPH and bioethics students. And then Dr. Villasante, who is not here, he mentors the biostatistics MPH students. And then Leslie Stallnacher mentors the public health practice students. And what's really cool about that, if you're coming straight out of undergrad, it's a very different setup where you get to meet with a mentor who not only makes sure that you are progressing to make sure that you're moving to graduate, but also talk about, well, what are your next steps? Are you trying to go work immediately in public health, or are you trying to go on to move to a PhD program or even an MD program, for example? So it's not just advising to make sure you're hitting all your checklist points for the MPH, but also to get you to your next step. As I mentioned, there are research and community partner connections. There is also an opportunity to add a global health certificate within your 4 to 5 semesters of the MPH. So you will not be extending your graduation timeline, which is really cool. Students who are interested in global health or even One Health really enjoy this certificate, and it gives you the opportunity to potentially go abroad, go to somewhere like Peru, and do some field work and kind of be within the communities and learn what that data collection looks like on the ground. And also, probably getting a little bit into the weeds, but we kind of try to kill two birds with one stone there, where it's counting for your global health certificate, but also counting for that applied practice experience that is required for your MPH. So you're probably wondering, all right, well, why do I get an MPH? And where do all of our graduates go? They end up all over the place. So we've got them in federal, state, and local governmental agencies. They're epidemiologists, program managers, and administrators. We have a lot of them that go to nonprofit service providers and related agencies. So they could be data analysts, or they do run statistics, or they do project management. And then lastly, as I mentioned, some of our graduates end up going to graduate or professional school training. Some of them end up back into our PhD programs, which is really, really cool and fulfilling. So yeah, so I just wanted to leave you with that. And I will also add that we are looking for there are 3 graduate assistant positions open for the MPH. So if you are interested in that, there's no separate application for that. You just apply. The committee will scan, and if your application stands out, we will invite you to an interview. With that said, that's on a rolling basis. So the quicker you get in your application, the higher the chances you are of potentially getting that graduate assistantship interview. Thank you.
Thank you, Dr. Agana. Next up, we have Dr. Heidi Spratt, and she's going to talk more about the MS in biostatistics and data sciences. Ready whenever you are, Dr. Spratt.
Yep. So hi all, welcome and good evening. So the MS in biostatistics and data science is a very applied program. What that means is that we aim to prepare students to develop and apply data analysis tools that analyze all kinds of different biomedical research data, from clinical trials to electronic medical records to claims data to basic science data to pharmacology data. We cover it all. What this means is that as a student, you'll be learning current statistical methods and theories, as well as how to apply those tools and techniques to current real-world data. You will also, during the process of obtaining your master's degree, you will be an effective collaborator on a research team. We have statistical consulting classes as well as a consulting practicum where you learn these skills and you actually do become a true statistical consultant in a mentored capacity in your final semester. I will say this is, I think this is on the next slide, but this is a 4-semester program. So during that time, you'll also develop statistical designs for working on all kinds of health science projects, as well as learning to write computer code for the management of data, as well as the analysis of data sets. Our students come out knowing both R as well as SAS, which are the 2 most commonly used statistical software programs out there. And you'll also, in many of your upper division classes, you'll be doing final projects where you'll be working with real world data to analyze it and prepare a report to the class about what you've done. You will also prepare reports for some of your consulting activities where you've worked one-on-one with different investigators across campus. And through those consulting activities, you'll also learn how to effectively communicate key statistical principles and results to what we call a lay audience, sort of a non-statistical audience. So next slide, Christina. So as I said, this is a 4-semester program, unlike the MPH. The MS degree only requires 36 hours of coursework, so that spans fall, spring, summer, and the following fall. Like the MPH programs, the MS program is CEF accredited. All of our students have access to electronic health record data for UTMB individuals, as well as national insurance claims data that they can utilize for any of their final projects or their capstone work. Also, like the MPH programs, all of our classes are small. We've currently got about 5 biostatistics students total. So our upper division classes are 3 to 4 students. Our first fall classes, the biostatistics general classes, are a little larger, maybe up to 12 students total. Our department has 10 faculty. So our student to faculty ratio is super duper small, which means that we've got a lot of room for individual attention and training, working with the faculty on all of our different research needs. The MS program also has the ability for students to have a summer intern position as a biostatistician within our Office of Biostatistics. This is unique and cool because it counts as job experience for your resume. So you would actually come out of the program sort of a little with an edge above a lot of other master's programs that don't have the potential for a true internship where you gain extra additional skills and working with collaborators. And just like the MPH program has some graduate assistant positions available, the MS in Biostatistics and Data Science does as well. We've got the opportunity to have 2 graduate assistants going forward. And just like Denny Faye mentioned, you don't have to check any additional boxes for that. If your application looks competitive, the review committee and the admissions committee will recommend you for an interview. And as Denny Faye also said, the sooner you get your applications in for that, the sooner you would be considered for such a program. The Master's Biostatistics and Data Science, lastly, we do offer 2 concentrations, one that is solely biostatistics and one that is a little more data science. The difference between the 2 is the biostatistics one, you are taking more advanced level biostatistic classes. Those include Introduction to Probability Theory, clinical trials, and survival analysis. Where the data science course, you're learning a little more of advanced programming with Python, as well as things related to AI and deep learning and natural language processing. So we do allow students the flexibility to choose either of those options. I think that's all I've got.
Thank you, everyone. And I'm just now noticing that one of my slides is missing. I think I uploaded I think I shared the screen for the older version. But I just kind of want to talk about a couple of incentives that SPPH is offering to our prospective students. So there is an opportunity, one, for you to be considered for an application fee waiver. So if you have an in-progress application already started, I would suggest that you go ahead and complete that application up to the point where you get to the payment section. Once you're there, please do reach out to us if you would like to be considered for one of those application fee waivers. And we will meet with the committee and determine which applicant will be eligible for those. We have a very limited amount of those application fee waivers. So I would highly suggest the sooner you get your application completed, the better, and then reach out to us for that. Also, we have a couple of scholars. These are not actual scholarships, but they're considered the Dean Scholars. So these are scholars that you may be awarded with admission. It is, like again, I said, it's called the Dean Scholars. This year, we're offering $1,250 for each application that is selected. It is highly competitive to secure. So again, I would make sure that my application is really completed. Your personal statement speaks to your academic abilities. If you have research, it's not necessary, but any information that you think would be important for the committee to review to consider you for one of the Dean Scholars, I would highly recommend you put that information in there. You're also welcome to mention any of our faculty names that you are curious about some of their research work, or that that you would like to, learn a little bit more from or collaborate on a research project with. Just let us know. It's not necessary, but just kind of giving you some tips to make your application really strong. If you have questions after today's session, please feel free to reach out to us. The admissions contact is my colleague, Tawny Stromberg. She's not on the session tonight, but you definitely can reach out to her at the admissions@utmb.edu email, and she will be happy to answer any questions that you have after this session. Also, I want to go ahead and introduce, we have some students that are joining us tonight, and I'm sorry, I'm trying to navigate my screen here. I know I've seen Alex Tan, Andrew, Tirina. I think I've seen Civi join us, and I think there are a few others. So first, I'll open it up for any questions that our guests may have. You can unmute yourself, or you can type them in the chat. And I'll go ahead and stop sharing my screen now. And just let me know if anybody needs me to go back to a particular slide, and then I'll open it up to sharing again.
Do we have any questions?
If not, I'll ask our students to share a bit of information tonight. What is your experience here at UTMB in SPPH, and what has been like here in Galveston? And anyone can jump out there and answer. Alex, Andrew, or Sibby, any one of you can go.
I can go if that's okay.
Sure.
Hi, everybody. I'm Sivi. I'm a first year MPH bioethics student. I think UTMB has been everything that I've imagined it to be like since I got here. I think one of the most important things about UTMB that was like a selling point for me was that it's a very tight-knit community, and I haven't really felt that in my other schools because I went to larger high schools, undergrad, things like that. So it's really great. You get to know your cohort really well. I have like really close working relationships with my professors, my faculty, and everyone is basically looking out for you here. And I think that's super important in a graduate program more than, yes, the classes are super important as well, but I think also building those connections and that rapport with, with your future, oh my gosh, what was I trying to say? With people that you're going to be working in the future. Sorry, I lost my words. But it's been really great so far, and I really do like that the class sizes are smaller. It's a lot of my classes are seminar style, being a bioethics student, so you really learn from each other, and I think that's super great. So yeah.
Thank you, Sibby. Andrew, Alex, either of you want to add anything to it, or we'll move along.
Yeah, I'll go next. Hi, everybody. My name's Andrew. I'm a second year MPH epidemiology student. So this is my last semester. And yeah, just in hindsight, being at SPPH has been a really, really good experience. Like kind of to reiterate what Sivi said, you really get to know your classmates really well. So my cohort there's only like 7 of us. And we've been through all the same classes together through and through. And yeah, it's really cool getting to be, I guess, more related and built up with your classmates as you go through like the challenging courses. And we even have gotten to know each other just personally, just hanging out off campus, going out to eat and stuff. So of course you get to work with each other in a professional way, but also UTMB is a great place just to get to meet more friends in the public health field, so I've really enjoyed that, just the close-knit cohort. And yeah, the faculty really does care about you. Dr. Agana is my mentor, and I go to her anytime I'm having trouble with something, and I wouldn't be where I'm at without all the staff and including her. So I know I was going to say something else. Oh yeah, there's also a lot of opportunities apart from classes to get engaged in the public health community. So there's a lot of seminars, like Sivi mentioned. There's a lot of good learning opportunities to learn outside of your concentration too, and a lot of volunteer opportunities. So we actually went this past, what was it, Friday, to do a Narcan distribution in Galveston Island during the Mardi Gras parade. And that was really fun. So you really get a chance to kind of put yourself out there and do some practical stuff for the community. So I think we distributed around like 14 of the Narcan treatments to people. And yeah, it felt really good to actually give back to the community in that way. So there's a lot of volunteer opportunities for you too. So, and Galveston is a great place. Yeah, it's really charming. There's a lot of good places to eat, and you can go by the seawall if you're ever stressed out after class and just, yeah, look at the beach. So that's helped me. But yeah, UTMB has been amazing.
Thank you, Andrew. So I'll move on to my next question. What would you advise prospective students ask themselves when considering a program?
I can take that. I know Andrew and Sivi, they talked a lot about how close knit UTMB and specifically SPPH program is, and I think if you want a program where you feel that everybody is kind of aligned with putting in quality work and just making sure that everybody's successful in their kind of own way. I think UTMB is a really great place, especially from my experience in the biostats department, where you can really build personal relationships not only with your peers but with faculty as well. and you can really find a lot of ways you can find a lot of ways to succeed and grow as not only a person but as a student. And I know that my experience at UTMB, I was very unsure of how it was going to be, but my whole perspective was just, every day put my best foot forward. And I think here is one of those places that if you really do that and put yourself in places to succeed, everybody around you kind of bolsters you and puts and really works on making sure you find that success that you want to. And it's been a really great place to call my home for the past semester plus. And so I really encourage you guys, just get the application in, and then once all your applications are in, then you can sort of decide what you want to do, if this program is right for you. But if you kind of like that close knit, really intimate kind of learning experience, and not only learning experience, but you know, developing your professional skills as well, then I think UTMB is a really great place.
Thank you, Alex. I have one final question. Compared to the other schools you applied to, what made you choose UTMB SPPH? And I think most of you, all of you have kind of spoke to it, but if there's anything else you want to add, we
Yeah, I
appreciate
was
it.
gonna say one thing. I think what's really special about UTMB is our Institute of Bioethics and Health Humanities. There's actually, I don't even think another program that has an MPH with a concentration in bioethics. And all the MPH concentrations are amazing, but this is my concentration, so I'm gonna put a little plug in. I think coming in, a lot of people are not, I feel like even I wasn't really sure of what public health was. I had a good understanding, but I think this focus and this concentration especially has opened my eyes to the fact that like public health is way more entrenched in a lot of social things. And like Dr. Moses was saying, our department, specifically BHH, is not just bioethicists or, people who are only in health humanities. Like a lot of our professors are philosophers, they have a literary background, they have a history background, so it's really special to have that opportunity. And it also gives you a very, deep understanding of health humanities and bioethics and how that can be translated into community outreach, engagement, policy making, even epidemiology. We kind of go back to these historical roots of health, and things like that. I'm kind of nerding out here, but it's a really special program, and I think that's also one of the reasons why I chose this program, and UTMB as a whole.
Thank you.
Yeah.
Yeah, I was
And
going to just
just to
say,
add on
and
to that, oh, sorry.
I'm sorry. I was just going to tell our guests they're still welcome to ask any question in our chat while we're having open discussion, or even unmute themselves. Just jump out there. Okay. I'm sorry, Alex. Go ahead.
Oh, I was just gonna add on to what Subi was saying. For biostatistics specifically, I applied to about maybe a dozen programs. And I felt like, lots of programs have different pros and cons, but I felt like the UTMB biostatistics program especially was very thought out. I think there was a lot of active, tailoring, and I've talked to Dr. Spratt, and I've seen they're always actively trying to see how they can improve the program and tailor it for where biostatistics is heading. And also, there's a lot of very unique opportunities that the UTMB biostatistics program gets, whether it's being a GA or the summer internship that Dr. Spratt was talking about. And I know UTMB can seem like in Galveston, maybe a slower type program where life is maybe not pushing out as many literature or research project, but the biostatistics program, especially, faculty is very diverse. We have professors from everywhere around the world, and really accomplished professors who really know their stuff, especially for biostatistics. And so I would encourage you to look through the faculty page and just kind of see the work they're doing for themselves. And yeah, that was kind of what made UTMB stand out to me when I was, choosing a program to attend.
Thank you, Alex. Would one of our guests mind unmuting or maybe just, I'm just curious because we talked about three different master's programs that we have available. So I'm just curious as to which program that you're interested in here, and if we've touched on any points that you were unsure about, or if we can expand on anything that we've discussed. We still have a little bit of time, so I just want to make sure that we have answered your questions, and so you're well informed, so that you can submit that application.
I can unmute. I'm applying to, my name's Elizabeth, it's on the screen now. I'm applying to the master's in the MA in bioethics. And I think this did help answer questions about more of like what the structure of the program looks like, as well as like what coursework is involved.
Thank you. Thank you, Elizabeth. Anyone else would like to let us know which program you are applying to?
I can say it. I'm currently really interested in the master program for biostats, and I was just wondering if Alex Hand can touch on more of why you chose this program instead of like other career that like faster or that doesn't take a long time to get into the job market, if you know what I mean.
Yeah, so I think for this master's program, they put you in a really good position through really a lot of application of what you're learning in lecture every day. They give you a lot of chance. There's a consulting class, and there's a lot of opportunities to work with faculty as a consulting biostatistician. So if you're really interested in quickly getting into the job market, UTMB is a really good biostatistics program to attend. And for my personal journey is my goal is more intent on pursuing a PhD, but my background in math in undergrad wasn't as intensive. And so this master's program was kind of a really unique opportunity for me to get my foot through the door, so to speak, and really start my path in statistics as well. And so, the professors here in the biostats program, they've been really supportive, and kind of guiding me, telling me what kind of courses I should take outside of UTMB to make my mathematics background competitive for PhD programs in biostats, as well as showing kind of guiding me on what will look good for PhD programs, what would look good, what would look good on my CV for being able to apply to jobs right after my master's. And so I think UNTMB, just with how much the faculty really cares about the biostats students, it's really a great opportunity to kind of use as a launching pad to your future career in biostats.
Yeah. And I'll follow what Alex said, that we want you guys to succeed. So whatever direction you want, if you're interested in going straight into the workforce after getting a master's degree, or if you want to transition into a PhD program, the sooner you let faculty know that, the sooner we can help you ensure that you get to do exactly the things you want to be doing, because we can tailor some of your training and some of your interactions to one direction or another so that you get the most out of the programs and are being able to be successful once you complete our programs. And that sort of goes for SPPH wide, not just biostats.
Absolutely. Any other questions, or anyone else would like to let us know which program you're most interested in? If not, I can give you back 10 minutes. I want to thank each of my program directors for joining us this evening and giving information about the programs and the funding opportunities we offer. I also want to thank our students for taking the time out of your schedule to be here this evening and sharing your perspectives. Any of our guests, if after we leave this session, you have questions, I believe all of our program directors have put their email addresses in the chat box. you're welcome to email any of them that's the director over the particular program of your interest. Also in the chat feature is my colleague Tawny Stromberg's email address if you have any questions about admissions. Myself, I'm happy to answer any question you have as well. I'm more so in the role of recruitment. So, but I can definitely answer any questions you have. If I don't have the answers, I can put you in contact with the person or persons that will be able to answer your questions. So again, thank you all for joining us, and I appreciate your time. Have a good evening.